I take you now to Chris Hani Baragwanath Hospital. That's here in Johannesburg in Soweto. It has been selected as one of the, to administer some of the Johnson & Johnson vaccines. eNCA's Hiedi Giokos is standing outside the hospital, which is the biggest in the continent and one of the biggest in the Southern Hemisphere. Hiedi, it was only a natural choice, right? That if the battle against COVID-19 is being waged, among others, at a site like Chris Hani Baragwanath Hospital, that hospital as well would be at the center of the vaccination effort, particularly here in Gauteng. What are we looking like in terms of preparations at that biggest hospital on the African continent?
Yes, most certainly, Tulas. Of course, this hospital would be a vaccination centre, given the fact that it is the biggest in South Africa and on the African continent. We tried to get some clarity with regards to how the hospital has prepared for the vaccine rollout. Of course, details are a little sketchy. We've been told to wait for the Premier's office to provide further clarity. But what's important to note here is the fact that various centres have been getting ready for the vaccine rollout, given the fact that they were expecting to inoculate healthcare workers in phase 1 from last week already, as they were expecting the AstraZeneca vaccine to be rolled out. However, of course, that was put on hold by government. But I think to get further clarity on the vaccine rollout, what we can expect, we are joined by Mia Malan. Thanks so much for your time, Mia. We really appreciate it. I think you know more than most, given the fact that we're not entirely sure what is going on with the vaccine rollout. But I think, first of all, on top of mind for everybody is, why is this vaccine being rolled out immediately? We knew with the AstraZeneca vaccine it was going to go for quality check for 2 weeks or so, but with this vaccine it's going to be rolled out as soon as 1 o'clock today.
So this vaccine is brought into the country with a different type of SAHPRA, our medicine regulator registration, than what the AstraZeneca vaccine was brought in. And the big difference is that this batch of Johnson & Johnson vaccines can only be used as part of a research setting, so in an implementation trial that we're implementing. And the reason we did that really was to get the vaccine quicker into the country, because Johnson & Johnson has also applied for wider registration, but that registration takes about 3 months, and they started to apply towards the end of last year. So we're only looking towards the end of February or March for that to be completed. And while that is being completed, this is the sort of stopgap measure to bring a vaccine immediately into the country, because the type of registration that you require for to use a vaccine in a research setting is very different. You can get it within a few days or a few hours almost from, I think in about 48 hours from SAHPRA, and that is why it doesn't have to go to Bloemfontein for tests.
And then just speak to us about whether or not you think government is ready for this rollout. We know that they were trying to get ready for the AstraZeneca vaccine. We know 17 centres have been identified. For phase 1, do you think that everything is in order for healthcare workers to be inoculated?
Well, I think the intention is there. I think it would be naive to think that nothing is going to go wrong. If we look at how health policies get implemented in the country, the problems always start on the provincial level when the provinces have to implement it. But the good news about this trial that we're implementing is that we are using some of the infrastructure that was used in the South African arm of the Johnson & Johnson trial. So there are already some measures in place that wasn't necessarily even put in place by government, that the Medical Research Council helped with that trial, and a lot of the vaccinators that they used are some of the vaccinators that will be used now. So it's not like we have to start entirely from scratch. There are some basics that we can work with.
And of course, government is in no position to delay this any further, given the setback of the AstraZeneca vaccine. Just in terms of how you expect things to play out today, we do know that the President, together with the Health Minister, are most likely going to be getting the vaccine today. You know, there's also a lot of fear with regards to allergic reactions. Is this the right vaccine? Just speak to us. You also wrote a very lengthy article about what we can expect. Just allay some fears for us with regards to the Johnson & Johnson vaccine.
So I think the first very important point is people are not going to be used as guinea pigs. We've got data for the Johnson & Johnson vaccine. It's not as if we're still trying to figure it out. This implementation trial is really just to get a little bit of additional data, and it's really a stopgap stopgap measure to get the vaccine into the country as quickly as possible. So we know that it is 85% effective in protecting people from severe COVID disease in South Africa. That includes disease caused by the new variant, and it is 57% effective in protecting them against less severe forms of COVID. That's the best that we've got at the moment. It's the only vaccine, it's the vaccine that we've got the most data for when it comes to protection against the variant. One of the ways to really counter vaccine hesitancy is to get publicly respected and high-profile people to take the vaccine. So but just before I came here, I saw a press release that the first vaccine is going to be given at 12 o'clock and it's also going to be taken by political readers. It's a well-established method. In other countries, that's exactly what they do. They go on TV with the president and have vaccines. The other way to address this is that the government would have to have very well-developed education campaigns to inform people about the data that we have, about the potential side effects so that they're not surprised if something happens, and also about the kind of protection that the vaccine provides, because no vaccine is 100% effective, and you can't create that impression, because if someone then gets COVID, they're going to think all the vaccines are ineffective, which is certainly not the case.
Okay, great. Thanks so much for your time here. We really do appreciate it. So I think, Tulas, just some insight with regards to why this vaccine is being rolled out so quickly. I know many people were raising concerns with regards to that, and also the fact that the president will be receiving the vaccine today at around 12 o'clock. That is, of course, a good sign to allay fears for many who are wondering, is this the right vaccine? Are there going to be allergic reactions? And perhaps some further detail with regards to that.
Yeah, absolutely. Important questions there being raised, particularly around the reason why there wasn't that sort of gap and a delay when the vaccine arrived last night as compared to what happened with the Oxford AstraZeneca vaccine that we were told needed to be taken to various facilities for further studies and tests to be conducted. So really important reporting there with